with a report on an effective alternative to hysterectomy. Here's our reporter, Laura Windsor.
Each year, almost 1 million American women have hysterectomies, many times for relief from heavy or prolonged periods. A new outpatient procedure called endometrial ablation provides a safe and effective solution.
Well, up until about 10 years ago, one of the primary reasons for undergoing a hysterectomy was abnormal uterine bleeding. And an endometrial ablation is a very safe, quick outpatient procedure with minimal recovery and excellent results. That is an excellent alternative for hysterectomy in women who have very heavy periods. An endometrial ablation actually ablates the lining of the uterus, or it destroys the lining of the uterus, which is the part that is shed each month during normal menstruation. And by destroying that lining with some form of heat or thermal energy, their periods either will become non-existent or much, much lighter. Well, an endometrial ablation is typically done in an outpatient setting, either in an outpatient surgery center or sometimes even in a doctor's office, and it only takes roughly 15 to 20 minutes. So you come in and go home the same day, little time out of work or your normal life, and there's essentially no recovery other than a 4 to 6 hour cramping period afterwards and a watery discharge for 4 weeks. So you get right back into the mainstream and the flow of your normal life. There's no incisions. There's, as I mentioned, no pain, and it's a quick recovery and very safe and very effective. It's typically done between the ages of 35 and 50, so in most cases they're before menopause and after childbearing. So we want to make sure that they're not pregnant, obviously, at the time we do the procedure. We want to make sure that they have a normal pap smear, and we've ruled out that they have any precancerous or cancerous changes on the cervix or the uterus. And we do a pelvic ultrasound to look at the ovaries and the uterine size and assess for other abnormalities that could be causing the heavy periods. Here at Hoag Memorial in Newport Beach, the majority, there's a 50-member staff of gynecologists that have all undergone some formal training in both hysteroscopy and endometrial ablation. Over the last 4 years, we've done many of these outpatient endometrial ablations here at Hoag, and I will tell you that I have many patients that offer to be my, quote, poster child. They say, I'd be more than willing to come and speak to any of your patients or come to any presentations on endometrial ablation because they think it's fantastic. For example, I have a few flight attendants that say they were really debilitated by their menstrual cramps and their heavy periods, and will actually plan their travel schedule around them or feel like they wanted to stay at home. And just with this coming in and having a 30-minute anesthesia, going home an hour later, they felt that their life was changed forever. So they're telling their friends, and people are coming in and saying, I want what she had, and it's a very nice alternative to a major procedure.
Women who are experiencing unusual or painful periods should see their doctor. I'm Laura Windsor for the American Health Journal.